Well, medication management is revolutionizing the way that we're able to take care of some of our family members, even remotely, and that is by the use of Dispenser that was created by MedX Services. Here to give us the details, Kent and Dawn. Good morning.
Good morning.
Thanks for joining us.
No, we're glad to be here.
All right, so give us the backstory on our friend Spencer and MedX Services.
MedX Services is a way with this device to be able to manage your medications at home independently, but at the right time, the right dose, with just a little bit of oversight thanks to technology with your doctor, pharmacy, and MedX Services.
So talk us through that process, because I know you mentioned the pharmacy. There is a bit of oversight there, so explain how that all works.
Yeah, so we partnered with it. We have a local pharmacy, Cherokee Pharmacy. They do all of the packaging of the medicine. So when we set up a new client, we sit down with them, we walk through all their medicine needs, talk to maybe who their physicians are, try to get them in the loop as well. And once the pharmacy packages the medicine, part of our service includes a full home delivery. So the patient never has to go to the pharmacy again. So we get the medicine to them, we drop it into the machine and dispenser here, and then for the next 2 weeks or a month, all they have to do is literally be there to take the medicine.
Right. They don't have to come to Spencer and push a button. It will dispense at the correct time.
Correct.
So talk about how you can set that up. I mean, it's not just one dispense a day. It's whatever you need.
It's exactly what you need, exactly what your physician has prescribed, that in full complement of medications you're on, and making sure there's no drug-drug interaction. They're packaged in a small dose, and they come out in the correct time, in that correct dose.
Spencer here is always connected to the cloud, if you will, to the internet. And anything that happens, when it's dosed, when the lid opens, when someone touches the screen, all that's uploaded. So now we make it available not only to the physician, the pharmacy, maybe the hospital, but we're always looking at it. So now we're including everybody in that patient's circle of care, if you will, to make sure not only they're getting the best care, but everybody has full visibility on whether or not they're taking their medicine, maybe on their weight, their blood pressure, on their sugars, because we can incorporate real-time devices. Here is the app that actually the patient, the caregivers or anybody can get on. They can click on it and see real time whether or not they're taking their medicine and what their weight was maybe.
And when you're talking about that, whether or not they have taken it, Spencer knows that by if the packet has been removed from the machine, right? Not just it spits it out, bada
That's
bing, bada
right.
boom,
They have to actually remove it from the unit itself to know that it's dispensed. And that's really important because a lot of times it will alarm and it sits there and it will alarm again to make sure that that prescription is taken and taken out of the tray. And the nice thing is your physician or your family member can see if there's a delay. We see if there's a delay.
Right.
And anybody can call and go, hey, Mom, take that little thing out of there and that beeping will quit.
Right, yeah, I hate to hear that beep. Yeah, so perfect. All right, so who is this really for and how do we get started with Spencer?
So, you know, they just need to call our office or have their physician call our office or contact us. Dawn's clinical team, we do a full in-home evaluation, make sure that, you know, that we're able to take care of them. It doesn't matter if the patient's on 8 meds a day up to 20 medicines a day. It's going to handle it, it can dose it, and we're just there to make sure the patient's medicine is taken the way it's supposed to. So they give us a call, and, you know, usually within 7 to 10 days, we can have them transferred over and up and running.
All right, that's a really quick turnaround. Thanks for joining us.
Thank you.
Absolutely.
We appreciate
Thank you
it.
for your time.